My name is Jazz, and I'm a student at Indiana Wesleyan, and this is my focused assessment. And is my subject for this focused assessment, and it is on acute sinusitis.
I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by students at Indiana Wesleyan University as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty, staff, as well as the student are held are considered not considered liable.
And what brings you into the doctor today?
I've been having a headache for the last 3 or 4 days and a lot of pressure in my head.
Are you taking anything for this headache?
I've tried some ibuprofen and some Theraflu, and then I've been sucking on Halls because of my throat.
What's wrong with your throat?
Just kind of hoarse and scratchy feeling.
Are you taking any Tylenol or Aleve for your headache?
Yeah.
Is it not helping at all?
No.
Where is the pressure in your head?
I've got pressure up in my forehead and around my eyes and across my cheekbones. And sometimes I get pressure in my ears. It feels like my ears are gonna pop.
How long has this been going on?
3 or 4 days.
Do you know what may have triggered it?
No, it just came up out of the blue.
Have you been sick lately?
No.
No. Has anybody in your home been sick?
No.
I'm going to take your vitals.
Okay.
Temperature. 100.2. You're running a bit of a fever. Let's get your blood pressure. I'm just going to take a listen to you. Take some deep breaths for you. Blood pressure is 132/94. Are you having any difficulty breathing?
Yeah, I've gotten congested. The steamy hot showers, I've been doing that. I just can't breathe, and it's just all draining, and I'm just miserable.
So your nose is draining.
Yes.
What color is the drainage?
Greenish with some orange and yellow in it.
Okay. Does it hurt when you swallow?
Yes.
You're a bit swollen there too. Okay, yeah. Do you smoke?
Yes.
Okay, how long have you smoked?
About 20 years.
Does the smoke alleviate the pain or does it add to it?
Sometimes I think it aggravates it.
Aggravates it, okay. Are you on any immunosuppressants right now?
No, but I am positive for autoimmune disorders.
Okay. Are you being seen under the care of a physician?
No.
No? Okay. Have you had any previous respiratory infections?
No.
Have you had a cold recently?
No, I thought that this was just the regular common cold. I thought I was coming down with cold and flu, and that's why I was trying the Theraflu to begin with.
Okay. Do you have pets?
Yes.
What kind?
I have 2 dogs.
2 dogs. Do you have any cats?
No.
No?
But I just moved into this new house, and the owners might have had a cat before. I mean, I don't know. I just moved in.
Are you allergic to cats?
I think so.
I think so. Okay. Where do you work?
I'm a nurse.
Are you? Where?
In a nursing home.
Is anybody sick at the nursing home?
Yeah, it's been going through the doors.
Do you have allergies?
I think I might.
Think you might. Okay. Have you been swimming lately? Do your ears hurt?
My ears do hurt, and I have a pool in my backyard, but it seems like the pool actually sometimes helps the pressure.
Helps the pressure. Okay. And what I think I'm going to do is I think what we have here is a case of sinusitis. You're explaining to me that you have drainage coming out your nose, that sometimes the hot showers relieve the drainage, and due to the fact that it is green and yellow, tells me that it's an infection,
Okay.
and we need to get you possibly on some antibiotics for it. Okay, so I'm gonna set you up with a nasal endoscopy and see if we can't have you tested for allergy.
Well, how long was that gonna take?
It'll only take a few minutes. We'll get you in to see the doctor. He'll just take a little small instrument and look up your nostrils. It's got a small light on the end of it, and he can see if they're inflamed or infected.
Does he use any numbing for that? Because I would imagine that would just really hurt.
There's no need for numbing, however, because your sinuses are inflamed, and I see you have some periorbital edema, you might feel some discomfort. However, it won't be painful.
Okay.
And an allergy test, again, a little uncomfortable, but it will tell us a lot about if you are allergic to cats right now, or maybe even if you're having some kind of reaction to the dander in your home because you have 2 dogs.
Okay.
Okay? So that's what we're going to do. For the meantime, I want you to take some Tylenol to help with that pressure, your headache.
Okay.
You might even want to take Sudafed or a decongestant to help your sinuses drain. And if it is bacterial, we'll probably get you a prescription, an antibiotic, probably Bactrim DS to help clear that infection.
Okay.
All right?
Now, what about like one of them like neti pots where you tilt your head sideways and flush out the sinuses? Would that hurt or help?
That won't hurt. It won't cure it if it is an infection. However, it will relieve some of that pressure and help drain the sinuses.
Okay.
Because really what you're doing is you want to try to use salt water to decrease some of that swelling, and it really does feel good. But if it is bacterial, we need to cure it with an antibiotic.
Okay.
Quick cycle, maybe 10, 14 days. If it's aggressive, we'll let the doctor decide that.
Okay. Now, do I need to come back in another week or two?
If it doesn't clear up after your antibiotic cycle, we do want you to call us back. We may need to do a CT scan, a little bit more aggressive therapy, because then it would be chronic sinusitis. Right now, I just think it's acute, and I think something has irritated your sinuses because of the drainage. Tells me it's infectious. Okay?
Thank you.
All right. Do you have any more questions or concerns before I bring the doctor in to see you?
No, I don't.
No? Thank you, Anne.
Thank you. You have a good day.